Currently I have 2 bone cancer patients, and they're both doing very well. One lady, all of her lab work is totally normal now. She lives in Fitzgerald, Georgia. I wish she could have been with us today, but they couldn't make the trip. Another man that I've treated for 15 years, I began treating him. He had stage 4 prostate cancer. He is totally well now and thriving. There's one a difference I'd like to make on this tape. If there's a difference between surviving cancer and thriving with cancer. If you can thrive with cancer, that's a good thing.
I am a cancer survivor. My name is June Black. I was diagnosed with ductal carcinoma in my right breast in November of 2000. I subsequently had a modified radical mastectomy on December 1st of 2000 and had immediate reconstruction during the mastectomy. Had several reconstruction revisions, and then I did not have chemo or radiation. The tamoxifen caused a rough reaction with me, so I quit taking it and decided to go non-therapeutic. In 2005, February, I found a lump on the mastectomy scar line. So he set up for a excisional biopsy, and it was cancerous, and which called a local recurring cancer, and it was the same type of cancer that I was originally diagnosed with. They had to do a subsequent surgery because the margins were not clear. They did another subsequent surgery, and the margins were clear, but he took another sample and found that it was spreading. So the oncologist called it multifocal cancer, which means it was spreading. And he recommended chemo, radiation, and adjuvant hormone therapy. And I said, can you guarantee me no side effects with chemo and radiation? He said no. I said, can you guarantee me 100% remission? And he said no. Then I said, why should I do this? Why should I ruin my quality of life? And I said, I won't do it. I went online, did my research, and of course I found the poly-MVA. It tasted so bad that I stuck it in the back of the refrigerator. I said, I can't do this. But I kept going downhill. I was losing more weight. I was very fatigued. I would fall asleep at work. I could not stay awake. I was pure white, not doing well at all. I scared a lot of people, but I said I'm going to find a way. And I went to a doctor in Las Vegas, a homeopathic physician, and Harry brings up poly-MVA again. I said, but it tastes so bad. And he said, well, you have a choice. Either learn to like the taste or I don't want to go there. I said, okay, I'll learn to like the taste. At 2 o'clock in the afternoon, I'm at work, and there was a shift. I didn't know what it was. It was like my body calmed down. I didn't have the little fevers that go with your cancer. And I realized that I was in what they called homeostasis. The body is at peace. It was incredible. So I went home, and I really slept that night. The next day, I was bouncing off the walls with energy, and I started to get color in my face, and people started becoming aware that I was getting color. But I was walking to the shed at work to get linens, and all of a sudden this whole shimmery feeling came over my body, and I knew I was okay. And the poly-MVA is my lifetime quest to tell people about it and have everybody win this war against cancer.
As an integrative oncologist who is board certified in both medical oncology and homeopathy, and who is board eligible in pathology, I highly recommend poly-MVA to any cancer patient seeking complementary therapy for his or her cancer. It is highly effective, very safe, and non-toxic and actually energizes our patients.
I am a cancer survivor.
I'm a cancer survivor.
I am a cancer survivor.
I'm a cancer survivor.
Hi, my name is Dr. Ahmed Nasri. I'm a general surgeon and a certified homeopathic doctor. My story with poly-MVA and alternative therapy in general started around 12 years ago when I met the late Dr. Rudy Falk. One of the main stems in our therapy consists of or includes poly-MVA. Poly-MVA, we prescribe it for all the patients as an oral supplement, but also we were the first ones in the world to use it also intravenously. And the reason is because we were adding a targeting agent, and we still do, called hyaluronic acid, which is abbreviated as HA. Now mixing this HA physically with the poly-MVA and administering it intravenously gives us or enables us to effectively target all the cancer cells, since all tumors have specific receptors for HA.
I am a cancer survivor. My name is Dr. Nancy Farley, and I relish talking to people about the good benefits, the good possibilities of a product called poly-MVA. In 1996, I closed my private practice in Florida, and I moved to Georgia thinking I'd have wonderful moments and times with my children and grandchildren. If I had not had a dear friend with me as I was unpacking boxes, I would not have paid attention to the symptoms of gross hematuria, which means that I was bleeding heavily in the urine. She put me in touch with a urologist, and after examination he said to me, "You have one of the largest malignant tumors in your bladder that I have seen in years." Well, he took his glasses off and looked at me and he said, "Lady, we operate tomorrow." Since that time I've become very familiar over and over with the diagnosis. It was transurethral resection in situ, stage 3, 3.5 to 4 centimeters long. I remember that label as I go back to the doctor year after year to be examined in a cystoscopy. And I have to tell you that the label that I now carry